As we mentioned, IVF is a technique, but it's a method applied to very different groups of patients. And during the procedure, it doesn't have to be performed in exactly the same way for every patient group. There are different nuances. Success rates also vary greatly depending on the patient's conditions. That's why it's not really accurate to take someone else's success rate and apply it to yourself or perceive it as your own, whether it's positive or negative.
What about patients who had negative experiences at other centers, Professor? I generally see these questions and these fears in my patients. What are your thoughts on this?
I try to understand patients like these, especially very sensitive patients, patients who have gone through very difficult times. So the biggest question is, what is it that bothers and upsets them so much during these treatment processes? I try to figure that out. The importance of this is as follows. Our treatments require continuity and repeated attempts, and they require patients to regain their motivation and start fighting again. A common trait among my patients who became parents after 13, 15, or even 17 years is that they came back for treatment again. After 8 treatments, after 10 treatments, the main factor that enables them to have a child, of course, there is the treatment I provide, all the interventions we perform, but the key is that the patient is able to come back, to walk through that door again.